Okay. I am verifying the doctor's orders and I am gathering my equipment. Knock, knock, knock. Closed door for privacy. Hand hygiene. PPE as needed. I'm scanning the room. Airway, breathing, circulation looks pretty good. Everything seems to be intact. Symmetry is good. Hi, Miss Roxy. My name is Taylor. I'm an ACC nursing student. Can you give me your name and date of birth, please? Okay, awesome. I'm going to check your MR number as well. Double check that. That looks good. I see that your breakfast tray is here. Did you have breakfast? Okay, great. Did you have any trouble chewing, swallowing? No, you didn't have any pain with that? Okay, great. Did you happen to go to the bathroom? Okay, last night? Alrighty. Oh, and you had diarrhea as well? Okay, did you notice any color or odor in your urine? Okay, anything unusual? No blood, nothing like that. Everything was good. Okay, so when you walked to the bathroom, you walked on your own? Okay, great. You didn't need to use a cane or a walker or anything like that. Okay, awesome. And you're not in any pain at all? Okay, great. And you're hearing me okay and understanding? Okay, awesome. Well, I'm going to raise the bed to a working position and I'm going to lower the bed rails. You don't have any allergies, right? Okay, awesome. I'm going to go ahead and start my assessment. I'm going to look at your pupils. Okay, great. They seem to be constricting and dilating pretty well. Can you open your mouth for me? Say, ah. Great. I'm going to look up your nose. Awesome. Everything seems pretty pink and pretty. I'm going to check your ears. I know you told me you were hearing me pretty good. That's great. Doesn't seem like you have any JVD or any edema, leg swelling. You don't have any joint pain, do you? Okay, great. Awesome. Well, I'm going to start by, I'm also going to take your cap refill. Okay, great. Less than 3 seconds. That's really good. Now I'm going to start by listening to your heart sounds. Okay. Just move that over. Okay. Alrighty, putting my stethoscope on the right side of the sternum, the second intercostal space. I'm listening for your aortic S2 sounds. Okay, great. Moving over to the left side of the sternum, second intercostal space. I'm listening for your pulmonic S2 sounds. Awesome. Okay, moving to the fourth intercostal space, left of the sternum. I'm going to be listening to your tricuspid. Okay, awesome. And going down the mid-clavicular line, fifth intercostal space, left of the sternum, I'm listening for your apical. Okay, and it sounds pretty good. I'm now going to be listening to your lung sounds. Placing my stethoscope over your throat, I'm listening for your bronchial. Okay, moving down, I'm going to be listening for your bronchivesicular. Sorry. And on both sides, I will be listening for that. And moving down again, I will be listening for your vesicular sounds on both sides. Awesome. Great. And palpating, I'm going to lean you up and palpating your scapula and your spine. Take a big deep breath. I'm gonna listen to both sides. Big deep breaths. Okay, great. And while I'm back here, I'm gonna look for any skin abnormalities, rashes, lesions, redness. Everything seems to be good. So I'm gonna lay you back down. Your breath sounds pretty good. No crackles, wheezing, or ronchi. Yeah, everything seemed good with your heart sounds and your breath sounds. I'm gonna lay you down now, and I'm going to listen to your abdominal sounds, your tummy sounds. Okay, in all 4 quadrants. Okay, great. Everything sounded good. Just the normal healthy clicking and gurgling. Now I'm going to palpate your stomach in all 4 quadrants. Just for any, maybe if there's any organ abnormalities or enlargements. Okay, great. Everything felt pretty good. I'm going to raise you back up. Now I'm going to take your vitals. I'm going to take your blood pressure first. Okay, blood pressure was good, 120/80. Your chest rise and fall, I've been watching it, it looks good. About 16 respirations. Your temperature, 98.2. I'm also going to take your pulse ox. Pulse saturation, about 95%. That's good. Now I'm going to take your pulse. I'm going to take your radial pulse first. Alrighty, really good and strong. About 65 beats per minute. Now I'm just going to feel all your other pulses. Your temporal pulse, your carotid pulse, brachial, and your radial I already did, it was strong and good. Your femoral, good. Popliteal, and your dorsalis, your posterior. There we go. All good to go. Okay, and your skin looked pretty good. I'm not seeing any rashes or lesions or redness either. I'm also going to change out my gloves just because I did just touch your feet. Okay, great. Awesome. Yeah, no rashes or lesions on your skin. It's looking good. I'm going to check your surgical site. Okay, dressing still looks good. And your IV site, that still looks good. No infections or anything. Okay, awesome. I guess I am done here. I'm going to go ahead and go. Do you have to go to the bathroom at all? No bathroom? Okay, are you in pain at all? Any pain? Great, okay, are you comfortable in this position? And do you have everything you need? Cell phone? Okay, great. I'm going to raise the bed rails and I'm going to lower the bed to its lowest position. And your call light is in reach. You just press this button. If you need me at all, I will come running. Okay, great. I will come back whenever. I'm going to take my PPE off. Throw that away. I'm going to wash my hands. And I'm leaving and shutting the door on my way out.